But the nice thing is that most patients, once they start getting better at 3 months, at 6 months they're better, at a year they continue to improve. So this is a stepwise improvement that we see. And you may ask, well, how long will that improvement continue? Which, that is an excellent question. I'm glad you asked that question. The correct answer is we don't know, but we do have some good data, data from multinational studies that were done, one based in the Czech Republic where it's up to 4 years. And then a very interesting study that I'd like to just talk to you just for a few minutes about, which is one out of the University of Paris. It's in what's called a white paper, which has not been published yet, but it has preliminary data in it. And out of the University of Paris, a famous researcher by the name of Philippe Hernigot went ahead and looked at a dilemma, which is, what do we do with patients that are over the age of 85? Because if you give them a knee replacement, they're gonna be in rehab for a good portion of the remaining portion of their life. So they took 60 patients and they split them up into 3 different groups. The first group, 20 of them, they gave them both knee replacements. The second group, they did the stem cell procedure to them on both their knees. And the third group, they replaced one knee and they did the stem cell on the other side. And now it's out to just over 7 years. And what they found out was that the patients who had the stem cell had lower pain scores, higher function scores, significantly lower complication rates, significantly lower cost to the French government. And then very interesting, when they asked the patients who had one knee replaced and the other knee with a stem cell, they said, please point to the knee that you like the best. Over 70% of them pointing to the stem cell side. And this is out at 7 years. So this gives us some evidence that this may actually be superior to a knee replacement, but this is a very small study. It's not yet published, but the preliminary data does give us this evidence that this may be a good, viable option.